Good evening. I'm Harry Keeling, and on behalf of the Alaskan Aviation Safety Foundation and Alaska Public Media, welcome to Hangar Flying. The last time we got together, our guest was Dr. Petra Illig, Senior Aviation Medical Examiner. Petra's been in Alaska since 2001, owns her own medical clinic where, in fact, many of us get our flight physicals. Petra, welcome back.
Thank you. It's a pleasure.
We were talking about having a series of shows, and last time you talked about why we have flight physicals, the role of the AME, and role of the pilot. But tonight, I'd like to talk about some of the common ailments or conditions that can impact flight physical status. So what are the most common conditions that can lead to grounding?
Well, pilots are just a subset of the general population. And so their medical conditions are reflective of those medical conditions that you find commonly in the general population. And of course, our population base is aging. So the most common conditions that we encounter with pilots are coronary artery disease, other vascular disorders, hypertension, diabetes, alcoholism and drug abuse, and certain psychological conditions. Of course, cancers as well. But I would say cardiovascular blood vessel disorders are probably the most common ones I face, either with simple treatment of hypertension or following intervention for coronary artery disease, like if a person is on the verge of having a heart attack or having had a heart attack. And so it's just reflective of what we find in our population in general.
Petra, can you talk a little bit about permanent grounding versus temporary grounding versus how a pilot gets back onto flight status?
Sure. There are very, very few conditions that are permanently grounding, and I think even the reasonable man in the street would understand. People who are afflicted with epilepsy, for example, which is seizure disorder, whether it's well controlled with medications or not, is permanently grounding at least for 10 years until the seizure disorder is cured. Most of them aren't curable. Some are with surgery, but if they're not curable, then they will be permanently grounded, simply because having a seizure during flight is not a good thing. Certain kinds of severe psychiatric illnesses, schizophrenia, for example, are permanently grounding. But most conditions, even if they're initially grounding, like having had a heart attack, like having had a stroke, like having had certain kinds of cancers, really in essence, if that medical condition is stabilized with approved medications, the person can return back to flight under an authorization called special issuance. Special issuance is a category where the individual's certificate is restricted to a certain length of time, shorter than the normal expiration date of medical certification, so that the treating physician can provide records to document ongoing stability. Then there's a whole new category of conditions AMEs can issue that are more of the common variety ones: hypothyroid disease or hypothyroidism, high blood pressure, certain kinds of cancers that actually do not require review by the FAA anymore, which is a wonderful thing, but it does require the appropriate documentation that the AME needs to review and then make sure that it meets the FAA's criteria. So that's very exciting.
So let's take a hypothetical case where someone had a heart problem and they got a stent or stents. How long would that process tend to last before they could, I mean, assuming everything went well?
Well, actually, up until recently, it was 6 months from the time that the event occurred or the surgical intervention occurred, and now it's 3 months.
Oh.
So, which is also very exciting, which also brings to the point that these criteria and these specifications change over time as the medical community and the FAA gets increasing comfort with certain types of treatments and intervention. Then the FAA will also shift their positions from being more conservative to more moderate. And so it's a constant, re-evaluating the guidelines on the FAA's part.
This is maybe a question that we're going to have to take over till the next time. But one of the things you and I talked about, which is very concerning, is you have pilots who are so afraid of sharing a problem with you, they might actually risk very serious complications, even death.
Oh, I have no doubt. I mean, I've had pilots tell me retrospectively after they've developed a comfort level that we're here actually there to help them, that in the past that they'd done exactly that. And certainly we know pilots will frequently deny themselves ongoing proper care because they're afraid that if they get placed on a medication or get evaluated for prostate cancer or whatever, that they might lose their certification. And it's just not true. If you get your physical health taken care of and properly managed, then the medical certification will almost always follow through with you.
Great. Petra, thanks for being on the show tonight.
You're very welcome.
Ladies and gentlemen, Petra's going to come back again next time, and we're going to talk a little bit about the other side, and that is what choices you can make as pilots for a more healthy lifestyle and may in fact avoid some of these problems. So until then, till next time, fly safe.